Welcome back. We are answering your questions about the coronavirus vaccine with Cone Health's Director of Pharmacy and Oncology, Dr. Andre Harvin. Remember, you can text your questions to 336-379-5775. A lot of questions here, Doctor, so let's just get going. What are the current guidelines for unvaccinated/vaccinated when exposed to someone testing positive?
So if you're vaccinated, that's probably the easiest one. If you're exposed to someone that's tested positive, you should be okay. So there's not a lot of hard recommendations around that. The vaccine protects you, it protects others, and so it does a great job. Obviously, watch for any kind of symptoms. With a person that's not vaccinated, it is really key that they also monitor for symptoms. Now, how their place of employment or place of education is responding to that is really down to the specifics around where they work or where they attend, of whether or not they need to quarantine. But we really eased up on the quarantine recommendations. They'll say, hey, make sure you mask up, let people know that you've had contact with a positive person, and continue practicing that social distancing.
Somebody texts us saying, before the vaccine came out, Dr. Fauci said if there was anyone that with allergies or using an EpiPen, they should not take or get the shot. If you have allergies to 5 different medicines and use an EpiPen, should you get the shot?
I would say they maybe want to go back and look at his statement. So it was more of a use caution. We saw in some of the initial studies when it was coming to, there was somewhat of an anaphylactic reaction that wasn't necessarily correlated with actual drug allergies. So it actually has to do with a little bit of the preservative or what's called like a vehicle that's used in the vaccines. And so people that are allergic to that, and a lot of times they won't know that they're allergic to that, but if they have an EpiPen, when they go in, they just want to make sure that that is being said. Anywhere they're going right now, we make sure that we have those things like EpiPens available. There are health professionals right there on site that help manage if anything were to occur. But again, that incidence is very low.
Someone asked us, why am I still being required to take a COVID test before having a procedure done when I am fully vaccinated?
Yeah, great question. It really just depends. So again, healthcare facilities, we are under different guidelines than normal CDC because again, we're seeing a lot of people that are immunocompromised that may be very sick. So that way they either have not received the vaccine at that point in time or potentially aren't even eligible depending on what's going on with them. And so there is an abundance of caution when it comes to stepping into a healthcare facility that exceeds that of any normal place. So we haven't gotten to that point across all facilities in North Carolina where we can say, hey, we know you're vaccinated, and so you no longer have to do the test. But I would imagine in the next couple weeks to months, we should see that change.
This is an interesting question. Someone said, I want to get the J&J vaccine in addition to the Pfizer vaccine, which I got in March. Is this okay?
So if you've already been fully vaccinated, I probably would ask them a clarifying question, like, did they only take one dose of the Pfizer vaccine, and then they wanted to supplement it with the J&J. But essentially, the recommendation right now is that you don't want to mix and match. So if you start off with the Pfizer, you want to do both doses of Pfizer. If you start off with Moderna, both doses of Moderna. We really have not seen any evidence or data that suggests there's any benefit of mixing and matching the vaccines. And so the J&J is a single shot. And so I would just want to talk to that person a little bit more and maybe dig into what they're asking.
Someone asked about people with autoimmune issues. Is the vaccine safe, and how much research has been done on it? Can we die getting a vaccine?
So again, the vaccine is exceptionally safe. What we've only seen with any incidences are potential dangerous anaphylaxis. And so that can happen in patients that have autoimmune diseases and those that have none of that above. Again, my focus is in oncology, and we actually recommend that a lot of our patients undergoing active chemotherapy and treatments still get the vaccine. So right now, there is no blanket recommendation for any group to not receive the vaccine. The best thing for you to do is to really go in, ask some questions, talk to your primary care provider. They may help you out with timing. So that's what we do with our oncology patients, and we'll let them know, hey, this many days after a chemo regimen is when we recommend you go in. But by and large, we recommend that all adults really seek the vaccine. It's the best thing that'll help protect you from the virus.
We have about 30 seconds left, but someone's wondering, I have high blood pressure and I go to a cardiologist. Should I really have the vaccine? Is it necessary?
It's absolutely necessary. So we see in patients with cardiovascular issues, lung issues, that if you really get sick from COVID-19, that your outcomes are much worse. So for patients that are struggling with those kind of aspects, especially anything cardiovascular, you're at a higher risk if you were to be infected with COVID-19. So you should absolutely seek the vaccine. It's something I absolutely recommend in patients that have any cardiovascular issues, and really for patients across the board.
All right, Dr. Harvin, thank you so much for your expertise and your time. We do appreciate it. Thanks for joining us.